Louisa Barton here for the CEP's Equine Initiative and the Horse Talk Show on Equus Television, visiting with Dr. Adam Kayott at Peterson Smith Equine Hospital and Complete Care. And we are going to chat about Alpha 2 because I know Isaac got B-roll.
Yeah, so Alpha 2's been around for a little while, used in humans first. So Alpha 2 macroglobulin is it's a protein that's constantly circulating in our blood and in the horse's blood as well. And its job is to remove inflammatory proteins. So we've devised a way to pull the horse's blood and concentrate this Alpha 2 macroglobulin into a certain volume. And then we can take that volume and we tend to then inject it into areas that are inflamed. And a lot of times it happens to be joints, and it happens to be other tissues and that sort of thing. And so that macroglobulin actually grabs on and binds those inflammatory proteins that are in the joint, let's say, and then it's removed via the bloodstream. So it's really nice. It's a biologic, so there's no other drugs used. So it's just what the horse produces, and makes it really nice. So you don't have to worry about, withdrawal time or holding time out of competition. There's no testing on it, nothing like that. And I've had really nice success with it, and clients have really enjoyed it. The other thing that's nice is that if you have multiple areas that need to be addressed, you can do it all in the same setting, provided you have enough volume. Yeah. Most horses will give between 30 and 35 mLs of volume, and then we take that and just and split it up to where it needs to go. The other nice thing about it is if you have any left over, you freeze it. It's good for 6 months. You can come back and readdress an issue, or if there's some other issue that's come up, then you have it, and you don't have to worry about processing it again or anything. You just thaw out the syringes and put it where it needs to be. It's super good for cartilage, because a lot of times when we put stuff in joints, a lot of times there's some steroid involved to take care of the inflammation. That can be a little bit detrimental to the health of the cartilage in the joint. So this doesn't have any of those adverse effects, because it's just basically a blood product. So it's really nice and healthy for the joint, and really nice to use in performance horses and that sort of thing. There's no pain masking or anything like that happens. It just takes that inflammation and those inflammatory proteins that are there and says, you need to go this way and be gone. And horses have responded really well to it.
Do they respond immediately, or is this over a course of days post the treatment?
So it's a good question. Most of them respond immediately. A lot of times, in traditional methods that we would inject joints, you generally would give them there's about a 48-hour lag time to when the medicine starts working and decreasing the inflammation. With this, it starts immediately, so you don't have to hold them off of work for any amount of time. You can keep them in training. Don't have to give them any time off. And
that was my next question. No downtime.
No downtime. No,
that's wonderful.
That makes it nice, and it helps keep the horse on that training schedule that works best for
That's
their
wonderful.
discipline.
And is it just one treatment to each area, or do you come back and retreat those areas?
So it's just one treatment typically, and then obviously if they need to be readdressed in several months' time, you can do that. A lot of times, horses will get a year out of that,
Wow.
of that treatment.
That's awesome.
Certainly. So,
and no
it's nice.
side effects.
No side effects at all.
That's
no,
wonderful.
No, because it's just the
them.
horse's biologic, what it's made of. So, there's no side effects at all, as far as that goes. I mean, obviously you have the possible side effects of joint infection, which all night any surgery can happen.
Right.
Anytime you do anything invasive, you have those possibilities, but generally there's no side effects to it whatsoever.
I know
nice.
you love seeing those sport horses go off and do well after.
Well, yeah,
so I know that's
it's really
very
nice.
rewarding.
And the other thing that's nice is if you have a metabolic horse that's trying, and you get a little nervous giving them steroids for laminitis and stuff, this takes care of that. You don't have to worry about that being a problem. So it's
Yeah, because there's that risk.
right. So
Yeah, right.
so when you're trying to address a performance animal, and you need to use steroids or whatever, it makes you a little bit nervous when they're already prone to laminitis. So
Right.
when you give them that steroid, it can kind of push them over the edge.
And this
but
way
this
you
gives you
don't
an
have to worry.
alternative. You don't
Yeah.
have to worry about it.
Wow.
So, super nice.
That's
Yeah.
phenomenal. How long has this been around?
I've been using it for about 2.5, almost 3 years now. It's been in the horse industry probably 5 years ish. People, I don't know. It's been around a little bit longer than that in people, and but so yeah.
That's a fantastic tool.
Yeah, it's nice. It's
Wonderful
really
to see
great.
those kind of results
really
without
great.
side effects
Yeah.
and concerns.
Yeah,
Phenomenal. Alpha 2.
Alpha 2.
I
That's
love
right.
it. That's fantastic. Dr. Adam Kayott, Peterson Smith Equine Hospital and Complete Care. For more information, 352-237-6151. Louisa Barton for the Horse Talk Show on Equus TV.